Hello and welcome. Today we are delving into a condition that affects millions worldwide but remains widely misunderstood: endometriosis. Endometriosis is a condition where tissue similar to the lining of the uterus, known as the endometrium, grows outside the uterus. This misplaced tissue can be found on the ovaries, the fallopian tubes, the outer surface of the uterus, and other organs within the pelvis. During the menstrual cycle, this tissue behaves like the normal endometrial tissue. It thickens, breaks down, and bleeds. However, because it is outside the uterus, the blood has no exit, leading to inflammation, pain, and formation of scar. So, who is affected by endometriosis? Endometriosis affects approximately 1 in 10 women of reproductive age. However, it is important to note that it can also impact transgender and non-binary individuals assigned female at birth. The exact cause of endometriosis remains unclear, but several theories exist. One theory is retrograde menstruation, where menstrual blood flows backward through the fallopian tubes into the pelvic cavity. Another suggests that hormones transform peritoneal cells, that's the cells lining the inner side of your abdomen, into endometrial-like cells. Genetic factors may also play a role, as endometriosis can run in families. Recognizing the symptoms of endometriosis is crucial for early diagnosis and management. Common symptoms include painful periods, that's dysmenorrhea, chronic pelvic pain, pain with bowel movements or urination, especially during menstruation, infertility, excessive bleeding during or between periods, fatigue, bloating, diarrhea, constipation, particularly during menstruation. If you experience any of these symptoms, it is important to consult a healthcare provider. However, diagnosing endometriosis can be very challenging. Diagnosis often involves a detailed medical history and symptoms discussion, pelvic examinations, imaging tests like ultrasound or MRI, that's a magnetic resonance imaging. Laparoscopy, a surgical procedure whereby a camera is inserted into the pelvic cavity to identify or possibly remove endometrial-like tissue. While there is no cure for endometriosis, several treatment options can help manage symptoms. Treatment management includes pain management medications like NSAIDs, hormonal therapies to reduce or eliminate menstruation like birth control pills, hormonal IUDs, or GnRH agonists, that's gonadotropin releasing hormone agonist. Surgical interventions to remove endometrial-like tissue, adhesions, and cysts. In severe cases, hysterectomy may be considered too, though it is the last resort. Do not wait for it to get to this stage. The moment you start experiencing some of these symptoms, any abnormal, as a woman, if you experience any abnormal symptom within your system, please, you need to seek medical attention to know what's wrong with you. If you go to the hospital and they tell you that, oh, you are okay, fine, you've cleared your doubt. But don't wait till it generates to a different level before, maybe a level that it might be too late for you. Living with endometriosis can be challenging, but support is available. Joining support group, either in person or online, can provide comfort and practical advice. So I advise you get a group and join, either online or in person, just like this group, as we grow supporting each other in a way. Advocacy organizations are also working to raise awareness and funding for research. For instance, in Australia, a drug called Vicin has been listed on the pharmaceutical benefits scheme, making treatment more accessible to those affected. If you or someone you know is struggling with endometriosis, my dear, you are not alone. Seek medical advice, explore treatment options, and connect with support networks. Thank you very much for watching. Stay informed, stay empowered, and take care.